Hi, everyone. As you're coming in today, I want to welcome you, and we're excited to have you here. I'm Marche. I'm the webinar director here at Advice Chaser. And before we introduce our guests and get started, we do need to do a little bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars, such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. Well, we are thrilled to bring you this educational presentation today. And go ahead and go to the next slide there, Danielle. Just a couple of notes. Attendees are muted, but we do encourage you to ask questions using the chat box. The presenter has said that she's happy to answer those questions, but we'll reserve those to the question and answer portion of the webinar today at the end of the presentation. One more thing, if we can't get to your question during today's event, make sure to leave your contact information as well, and we'll make sure that someone reaches out to you after today's event to address that. So once again, please don't hesitate to ask for clarification or expansion of the material, and we'd be happy to address those. I'd love to introduce you to today's guests. Dave Grant is our moderator today, and he is a certified financial planner professional and the owner of Retirement Matters. Dave has provided fee-only fiduciary financial advice to clients since 2007 and specializes in retirement income planning. His initial focus with clients is to help them understand what they want to achieve in life, what goals to set, and how important those goals are in comparison to each other. It's then his job to bring the best investing and retirement income strategies to aid in building an ideal life and having a customized financial plan at his clients' fingertips. And Dave, why don't you go ahead and come off of mute and say hello? We're so glad to have you here as a moderator today.
Thank you, Marche. It is a pleasure to bring Danielle here, knowing that she's the expert in all these things. And I know whenever I have questions on this, I always head to her and Boomer Benefits because they have the answers that I don't.
Very good. I'd love to introduce you to our presenter today. Danielle Roberts is the co-owner of Boomer Benefits and author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. Her licensed insurance agency specializes in Medicare insurance-related products with more than 75,000 policyholders across the nation. Boomer Benefits educates Medicare beneficiaries about their supplemental insurance options so they can confidently choose the insurance plan that best fits them. Policyholders have access to their legendary client service team, who helps them with Medicare appeals, claims denials, drug exceptions, annual Part D analysis, and much more. A recognized Medicare insurance expert, Danielle is a frequent speaker for both agent and consumer groups, and she has been named Outstanding Member of the Year by the Fort Worth Association of Health Underwriters, where she is a trustee and past president of the 200-member local association. Danielle, I am so glad you're back with us. I do want to note to our attendees that we have had Danielle once before, and for a Medicare in general webinar going over that. So that is also available on our advicechaser.com website. But I'm going to turn the time over to Danielle now to talk about Medicare Part D.
Okay, well, thank you for that lovely introduction. Sure to appreciate that. And we will take off today and dive into our content about how Medicare Part D works. It's funny when I do webinars that are Medicare 101, it takes a whole hour just to go over Medicare basics and the types of plans that you can enroll in. And then Part D is its own animal. And I'll show you today how it came to be, when and how you enroll in it, and all of those good things. Normally, when I talk to people about Part D, they feel overwhelmed because when you first turn 65, you're getting lots of mailers, you have brochures and flyers and postcards telling you about all these various Part D plans that are available in your area. States often have 20, 30 plus plans to choose from. And the terminology is not very familiar to people unless you are an insurance expert like me. You probably don't know exactly what deductible, coinsurance, copays, and coverage gap, those kind of words mean. And don't worry, you don't need to be an expert at any of this. I'm going to guide you through the most important pieces today. So what we're going to cover are the 4 stages of Part D, which includes the coverage gap or the donut hole. We'll talk about that today. Everyone has lots of questions about the famous, or I should say infamous, donut hole. We'll talk about how the deductible works on Part D, different drug tiers and formularies and what those mean. I'll show you how to review your drug coverage every year so that you can use the annual election period that happens in the fall to save money by evaluating which plan will be right for you for the next year. I'll go over why you should enroll in Part D, including how to avoid the late penalty. And then I'm going to talk to you about why Part D will drive you nuts no matter which plan you choose, so that when you feel like you want to tear your hair out as you go over your Part D decisions every year, you'll be able to rest assured that you're not the only one. It's just a rather confusing part of Medicare. So let's look at some of the basics and where this Part D came from. So for over 40 years, and actually, I think over 50 years, there was no outpatient drug coverage under Medicare. What happened was, back in the day, in the 60s, when Medicare was created, insurance plans back then looked different. They were modeled after the old Blue Cross and Blue Shield plans, which had an inpatient and outpatient benefit. Coverage of drugs in insurance plans on an outpatient basis came later, after Medicare was already created. And so for a long time, people were on these plans, and they had Medicare in place, but they were having to pay out of pocket for their medications. And back in 2005, I had clients, some of them spending over $10,000 a year on their medicines if they had some expensive medicines. We saw this a lot with people on taking expensive medications for diabetes. We see it now today with people who have cancer-related medications. The fortunate thing is that now we have a program to help limit some of that potential spending that you might have if you find yourself needing a medication that is rather expensive. So we're very lucky today to have Part D, which is basically a pharmacy card. You're going to present your Part D insurance card at the pharmacy, and this allows you to buy your prescriptions at a copay or a coinsurance instead of having to pay full price. There's different stages to the drug plan during which it pays one amount or another toward the cost of your drugs, and we're going to go over those today. So again, this type of insurance, you're going to enroll in it through an insurance company, and then you present that insurance card when you go to the pharmacy. So Part D is only about your outpatient medications. It doesn't talk about inpatient medications that like you would be receiving in a hospital stay or at your doctor's office. So first things first, how would you enroll in a Part D drug plan? Well, you're first eligible for one during a 7-month window, which is called your initial enrollment period. And this coincides with your initial enrollment period for Medicare. So you have 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after to enroll in Medicare Parts A and B. And if you plan to get a drug plan, that same window is when you would enroll in a Part D drug plan. Now, there are no late penalties for not getting a drug plan if you're postponing it because you have some other creditable form of coverage, like creditable employer coverage, drug coverage through an employer where you're still working, or if you have veterans benefits or TRICARE for life. Folks with those types of benefits do not need to enroll in Part D. They can delay it until later when they do need it, and there wouldn't be a penalty. There is a penalty for late enrollment into Part D if you don't enroll when you're first eligible and you don't have creditable coverage, and we'll of course talk about that today. So who is eligible to enroll in Part D? You must be enrolled in either Medicare Parts A or B. So of course you're entitled to enroll in Medicare and eligible for Medicare at age 65 here in America. And as long as you're enrolled in either A or B, you can also pick up a Part D drug plan. You need to live in the plan's service area, which is usually by state. So you, for instance, I'm in Texas, you would be choosing a state that's offered in this, a plan offered in the state of Texas or wherever you normally live. And then you have to enroll during an approved election period. That initial enrollment period that I just went over with you is one of those election periods. There are no health questions for getting a Part D plan, so they can't discriminate against people who take more expensive medications. Everyone is entitled to enroll in one Part D drug plan at a time. Also, once you are on the drug plan, you have an opportunity to change that once a year in the annual election period. So from October 15th to December 7th, this is the time of year when you can enroll in a Part D drug plan, change a Part D drug plan, or disenroll from one. That is the window, and all of the changes that you would make during this period will always take effect the first of the month after. So I want to point out that you do not enroll in Part D at the Social Security office like you do with Parts A and B. Parts A and B come from the federal government, but Part D is voluntary or optional. And so you're going to enroll in that by choosing a Part D company that offers a plan in your state. And I'll show you, of course, how you will do that. So again, the only two parts that you're going to enroll in down at the Social Security office or Railroad Retirement Board would be Parts A and B. So there's two different ways that you can get your Part D drug plan. You can enroll in a standalone Part D drug plan. We often see this when someone enrolls in original Medicare, a Medigap plan, and then a standalone Part D drug plan. That's typically one route of coverage. But some people choose to get their A and B and D benefits through a Medicare Advantage plan, and that is another way. So you would be choosing one or the other. You would never be involved. You would never be try to enroll in both. That is not allowed. So the different ways that you could sign up would be to call an insurance company that is offering a plan and enroll online with them. You could also go to their website and enroll on their website. Now, let's say you found a plan that you liked in your state and the premium was $20 a month. If you enroll directly through the insurance company, you're going to pay $20 a month, but just keep in mind, you don't have an agent in that situation, so there's no back-end support. And what that means is when questions and things like that arise, you would often be dealing with those on your own or calling a call center at the insurance carrier trying to resolve those. The second way you can enroll is through an insurance agency or broker. Brokers like us do not affect your rate. So you would pay $20, exactly the same premium for that plan. But what you then have is an agent. There are a lot of independent insurance agents out there that offer Medicare Part D plans, and that service to you is free. So when you have questions that come up, you would know exactly who you're going to call, and they can direct you on how to resolve issues. Your other option is to enroll through Medicare. You can do that at medicare.gov. You can also sign up for mymedicare.gov, which is a personal account of yours at Medicare, and you can search for plans within there and you can enroll within that online. And then if you have a need for back-end issues, you would be calling either the insurance carrier or you could call with general questions to Medicare. But again, you'd be paying exactly the same premium either way. And so that's why enrolling through an insurance agency sometimes makes sense for people because they want to have that back-end support with questions and things like that. So what type of things should you expect from an agent when you enroll in a Part D drug plan with them? First of all, if you're ever standing at the pharmacy and they say, well, your plan is denying this fill, and you think, oh my goodness, you may wonder, do I call the insurance company? Do I call my doctor? Do I call Medicare? I'm not sure what to do. This is the kind of thing that happens all the time because there might be a prior authorization or a quantity limit restriction. And these are things that if you enrolled on your own, you may not have noticed when you enrolled or you weren't aware of. So those are the types of things that an agent helps with on the back end. There's also something called drug exception. So let's say that you have a new prescription that gets prescribed and your drug plan doesn't cover that, but your doctor says this is really the medicine that he wants you to take. Well, he can file an exception with the insurance company and ask that they cover it for you through the end of the year. There are some forms that have to happen. There's a process that happens here, and every now and then there'll be a glitch or a hang up where that kind of stalls. An agent would be someone that you could call if you have something kind of hanging there and it's pending and it's preventing you from getting your medication filled. They can get involved and try to help you move things along, because we of course know who to call and for things like these. Maybe there is a billing issue. You can choose to pay your premiums to your Part D plan a number of different ways. On the application, they'll give you choices like a coupon book or a monthly invoice or bank draft. They also will offer, if you want to have your Part D premiums taken out of your Social Security check. And when you choose that option, sometimes there's a delay. So you think that Social Security is deducting the money for your Part D plan, but you didn't realize that there's a delay. And so they're sending you an invoice in the meantime, and you may be confused about, do I pay this or not? These are the type of questions where having an agent really comes in handy, because you know exactly who to call. There are also late penalty resolutions. So if someone is assessed a late penalty and they don't think that they should have been, your agent would help you with how to go about filing an appeal with Medicare's vendor, which is Maximus, and then moving that along so that hopefully you can get the late penalty removed. So that's just to give you an idea of why you would maybe consider an agent to help you with something like that. So now let's talk about the 2022 Medicare Part D stages and limits. Every Part D drug plan has 4 stages, and there are drug limits that you hit which progress you to the next stage. So with Medicare Part D, the 4 stages are upfront. There is a deductible, and you satisfy that before you satisfy the deductible before the plan begins to pay any money. Then there is an initial coverage limit where you're going to the pharmacy and getting it filled. You pay a copay, but the insurance company pays the rest. If your drug spending goes beyond a certain limit, you fall into the donut hole. And during that period of the year, you might pay more for the medication than you did prior. And then all of them have a catastrophic coverage at the end to sort of stem some of that bleeding and make the insurance company pay a larger share. So we're going to look at those each in a little bit more detail. One thing to understand is that all Part D drug plans must cover certain classes of medications, and they must also cover at least 2 medications in every therapeutic class. So although each different Part D insurance company is different, there are parameters that they have to meet in order to be approved as a drug plan. So they have to stay within those limits and parameters set by Medicare. But within those, they can make their own choices. So they could decide how much of a monthly premium to charge you for the plan. They can decide which medications fall into which tiers and what your copays for those medications will be. They can decide what other drugs they're going to include on the formulary besides the ones that are required. And they decide what kind of restrictions they might put on medications, such as quantity limits. Now, when I mentioned that requirement for covering at least 2 medications in every therapeutic class, that is specifically designed for the scenario where you enroll in a plan, and then a couple of months later, you have a new health condition, your doctor prescribes a new medication, and that medication may or may not be on the formulary. So let's say you have this new health condition develop, and the doctor says, well, I should take this medication, and that medication is not on the formulary. Your doctor can file an exception for it, but he could also look at the drug formulary that you're on and find other medications that are covered. And that's why all drug plans must have at least 2 meds in every therapeutic class. So let's say you develop a new health condition where you need to take a cholesterol medicine, and that cholesterol medicine, your doctor can look through all the formulary drugs in the plan that you're on and choose one of those that is included so that you can treat that condition. That is so that anytime you develop a new health condition, you can rest assured that there will be at least some medications on the formulary for your doctor to choose from to treat you with. And if he wants to treat you with one that isn't covered, this is why we have that annual election period in the fall for you to change, because that next fall you could then look for a plan that covers the one that he really wants you on. Also, all drug plans must substantially cover 6 protected classes of drugs. These are immunosuppressants, antidepressants, antipsychotics, anticonvulsants or seizure medications, antiretrovirals, and oral chemo medicines. The oral chemo meds have become very popular in the last few years with the pandemic. as doctors were choosing to let their patients treat at home instead of having to come in and expose them to COVID potentially out in a hospital or clinical setting. And so we've seen more and more chemo meds come into the formularies for Medicare Part D. The good thing about this is in every state, you're going to find a wide range of drug plans, and you will have some that are really inexpensive and some that are very expensive. And what you will notice is that a basic drug plan that has a pretty low premium may have a smaller list of covered medications or a different list of covered medications than a richer drug plan. But even the very basic plan must cover at least these 6 classes. So there's no such thing as you enrolling in a drug plan and not having access to certain oral chemo meds or immunosuppressants, et cetera. Okay, so back to our 4 stages with Medicare Part D. In 2022, the deductible is $480. That means that each time a carrier develops a drug plan, they can set the deductible wherever they want to, except it can't be higher than $480. Most of the drug plans that are out there will charge the whole $480 up front. So that means when you're going to the pharmacy and filling your first few medications in January, you're coming out of pocket until you have paid $480 for your drugs. Then you progress to stage 2, which is the initial coverage period. During this period, you are just going to pay the copay or coinsurance amount listed in your summary of benefits for your plan. So let's say you have a drug that's a tier 1 preferred generic drug. You open up your booklet and you see that your copay for that drug is $1 or $5. So you're paying a portion and the insurance company is paying a portion. Medicare tallies the amount that you pay and the amount that the insurance company pays. And if your drug usage goes over $404,030 in 2022, then you fall into what's called the coverage gap or the donut hole. During the donut hole, the insurance carrier can charge you no more than 25% of the cost of your drug. So even if what you pay goes up from the initial coverage level to the coverage gap, you will know that the insurance company is still covering 75% of the cost of the medication. Medicare will continue to track your spending during the coverage gap and any discounts that you're getting from the pharmaceutical manufacturers. And when that amount reaches $7,050 in one calendar year, then you could reach something called catastrophic coverage. Catastrophic coverage is recognizing that you have now spent thousands of dollars this year toward your own Part D drugs. And after that point, you don't have to pay any more than that. So I've given you kind of the broad overview, and I'm going to show you some of the details within some of those things. So when you're in that deductible period, as I said, the insurance company can choose to enhance their plan and set a lower deductible, but it can't be any higher than $480. But I want to share with you that a lot of times people will come to us and they're like, I want a drug plan with no deductible. And I can assure you that if you do that, typically that drug plan is going to have a higher premium and the medications are going to have higher copays. So the moral of the story here is the insurance companies are typically getting that $480 out of you one way or the other. You're either paying it in an upfront deductible and then having lower premiums and lower copays on the back end, or you have a smaller deductible or no deductible, but you're making up for that because you're going to be paying more for the drug plan and more for the copays. We see this all the time because we run thousands of these drug plan analysis for our own policyholders every year at Boomer Benefits, and this is what we always see. And that's why so many of the drug plans just charge the regular $480 deductible so that it's a more even playing field on the back end. But you'll be able to decide that for yourself when you're choosing a plan, which route you want to go. Once that deductible has been satisfied, then that's when you enter that initial coverage level. And while you're in the initial coverage level, each of the drugs that you take is going to fall in a certain tier, and then you pay the copay associated with that tier. Medicare is tracking your drug spending and the plan's drug spending so that they will know if and when you're going to hit the coverage gap. Now, while you're in the initial coverage level, you will have usually 5 tiers of drugs, although there are some out there I think that do 6. These are typically very similar to what the types of plans you've had under 65. When you fill a drug that's a preferred generic, you're going to pay a lot lower copay than you would if you filled a drug that's a non-preferred brand where you're paying a higher percentage. Now, this varies by plan. There are some plans out there where you pay $0 for a preferred generic. There are some out there where you might pay $5 for a preferred generic. And so when we're helping someone analyze which drug plan is right for them, we always want to look at the whole cost picture, not just the premium. We want to look at what you're going to be paying for your specific medications throughout the year based on which tier they fall into. And so when choosing a drug plan, it's so important to make sure that that drug plan includes all of the medications that you need in the formulary and that you can afford that copay before you enroll in that plan. So you're going along and you're paying your copays and you're paying your copays. And if you go past that $4,430, then that's when you enter the coverage gap. While you were in the gap, again, it's not as bad as it used to be. Back in 2006, if you fell in the gap, most of the plans would go back to charging you 100% of the cost of the medicine. But the ACA legislation has changed that. And so now when you fall in the gap, you're only paying 25%. Sometimes we find that the drug actually costs you less in the gap than it did during initial coverage, because that copay that the carrier set during the initial coverage was actually more than 25% of the cost of the drug. So it's not always a bad thing, but if you have a drug that is a preferred brand or a non-preferred brand, often when you go in the gap, you may find yourself suddenly in the middle of the year paying more. So if you've been going along paying $40 for a drug, and then the next time you go in and you fill it and it's $75, you will know, oops, I hit the gap. This must be what's happening. They also, each of these carriers will have a member portal that you can sign up for, so you can go in and track your spending, and you'll be able to see on your explanation of benefit statements that what happened now is that you have reached the gap. Now, let's say you're in the gap and you're spending 25% on all of your medications. If you come out of pocket $7,050 in a calendar year, then after that, the insurance company has to take over and pay for 95% of the cost of the drug for the rest of the year. So the good thing about this is when you hit the catastrophic coverage, suddenly now you're paying a much smaller share of the drug. The bad thing is there's no limit on that 5%. So if you had a pretty expensive medication, say you have an oral chemo medication and it's $5,000 a month, even when you get to the point where you pay 5%, it's still going to be a pretty penny. So this is something that we see come up in Congress and in various legislative initiatives on a regular basis, where especially you've probably noticed in the last few years in all the elections, there's a lot of talk about drug pricing and how America can work on drug pricing. And so we are always hopeful that at some point Congress will correct this and give us a true maximum out-of-pocket limit. But the way it is right now, it only limits your spending to 5%. Okay. So let's talk about what type of costs that you are going to encounter when you are on Part D. First of all, there's the monthly premium that you pay for the plan. So let's just say that you find a plan from XYZ insurance company, and their plan is $20 a month. That is the monthly premium that you pay to the insurance company in order to get the plan, in order to be covered by them. Just like you would pay a premium to Geico to have your auto risk covered, you're going to pay a premium to the Part D insurance company to cover your drug risk. Then some people who are in high income brackets pay an additional amount. It's called the income related monthly adjustment amount. We call it the ugly Aunt Irma, because nobody likes to hear that they get to pay a higher premium to Social Security because they're in a higher income bracket, but it's just the way it is. Then when you enter the drug plan and you're using your coverage, we have that deductible up front that we talked about. You then have your copays or for your individual medications as you progress through the various stages. And then sometimes there are people that have a late penalty that may be added on. So the costs can come from quite a few different areas. Now, the good news is that there's really affordable drug plans out there. So in most states, you can find drug plans as low as around $7. I think there's 1 or 2 states that have one plan that's $5.50 or something like that. So there's an easy opportunity to get a very inexpensive drug plan and have coverage. But there may be a drug plan in your area that costs a lot more. There are some out there that are over $200 a month. And then when you open up that summary of benefits and you look at the drug formulary, you would see the reasons why. It might be that it's covering a few really expensive medications that other ones are not covering, or it may be that it's got a high premium, but there's no deductible, and they limit your spending in the coverage gap. They're all going to be different within there. They have the 4 stages that they have to follow, but they can enrich the plan beyond that point to whatever extent they want to within the federal guidelines. So if we were to take everyone in America and average what they're paying for Medicare Part D in 2022, the average monthly premium is $33 a month. So if you're just here today to ballpark your future spending on Medicare and you're trying to forecast that, then I would use $33 as an estimate for what you might spend on Part D. Now, if you're in one of those higher income brackets, it works like this. You will pay the plan premium to the insurance company in whatever mode you chose on your application. So maybe you chose bank draft, maybe you choose coupon book. That's the premium that you send to the Part D company. Then Social Security is going to take a look at your income, and they may send you a bill for that IRMA we talked about. So they're going to be looking at your tax returns from 2 years ago. In 2022, they're looking at your income that you filed in 2020. And if your income, let's say you were a single filer and you earned $100,000 that year, you can see there on that second row, you would pay the plan premium to the Part D carrier, and then you're also going to get a bill from Social Security for $12.40 a month. If you are already on Social Security retirement benefits, they just take that $12.40 out of your Social Security check before they deposit it into your account. Likewise, if you were a married couple and on your 2020 tax return, you had a household income of $300,000, then you and your spouse would each pay your own plan premium, and you would each pay $51.70 per month to Social Security for that IRMA adjustment. Now, maybe you earned more in 2020, but now you earn less because you have retired. You don't have to wait the 2 years for that to catch up with you. You could submit evidence to Social Security that you've retired. There's a form called SSA-44. You can file that with Social Security and show them that you're no longer making that income, and they often will adjust that down for you immediately instead of you having to wait for that to catch up. Now, if you didn't file the reconsideration, you would pay that higher IRMA, but every year in December or January, you'll get a notice from Social Security. It's called a benefit determination letter. When you get that letter in the mail, you will see they've looked at the next most recent tax return, and then they're going to update that. So even if you didn't file the appeal, it would catch up to you in 2 years, and that premium would go down, or that IRMA would go away if you weren't in one of those higher income brackets, but there's no need to wait. So if you've had an income change that is making you earn less now due to retirement, marriage, divorce, the death of a spouse, and a couple of other reasons on the form that are allowed, you can file that and ask them to take a look at it sooner instead of you having to pay all the premium in the meantime. Okay, so I want to give you some of my best tips for choosing a drug plan that's right for you. First of all, you never choose a drug plan based on just the premium. We want to look at the overall annual picture of your spending on that drug plan. So you want to choose a plan that will give you the lowest total annual out of pocket for your specific medications. So we have a software and we run all the medications and we take a look and see which one is going to cost you the least in your overall spending if you include premiums, deductible, copays on that particular plan. You can also do this same search inside your mymedicare.gov portal, which I mentioned earlier. Enter your medications, run a search, and it will show you which drug plan is going to be the most cost effective for you for the next year. The second thing is you always want to look up your drugs in the formulary to make sure that they are covered, and then you want to look and see what kind of restrictions are on those medications. So for example, a lot of pain medications will have quantity limits. If your doctor prescribes you more than the quantity limit allowed by the carrier, the pharmacist is not going to fill that until your doctor files an exception with the carrier to try to get it increased. There might also be medications which require a prior authorization. So maybe the doctor prescribed a drug for you, and in the formulary it shows prior authorization. This means the doctor needs to fill out additional information with the carrier to explain why you're taking that medication. Maybe you're taking it for an off-use reason, or there might be other reasons why they want additional information before they'll fill that drug. And the last one is step therapy. So this one happens when your doctor has prescribed you a very expensive medication, but there are other medications on the formulary that are cheaper that would treat the same thing. The carrier, drug insurance carrier, wants you to try the cheaper medicines before they're going to approve the more expensive medication. Your doctor can file an exception saying, I've already tried those medications with this patient and he or she is allergic, or they didn't work, or whatever reason they're giving for why they want to prescribe you this more expensive medication. The carrier will review that information and make a determination whether or not they're going to approve it and cover it for you for the rest of the year. So every formulary from every drug plan is going to have some restrictions, but let's say you're deciding between two drug plans and you're looking over all the information. If one of them has a quantity limit on one of your medications and the other one doesn't, you might lean toward the one that doesn't have the quantity limit because you will have less hassles, of course, with some of the paperwork that has to be filed on the back end when your doctor is prescribing medication. Tip number 3 is when you're entering a list of medications that you either put into mymedicare.gov or you give to your agent to run for you, you always want to make sure that you are giving the name that appears on the pill bottle. So we see this one happen all the time. For example, people will say that they take Synthroid, which is a thyroid medicine, but they're actually taking levothyroxine, which is the generic version. Well, if you list the brand name drug, the portal, the mymedicare.gov portal, is going to search for the one that offers that brand name for you at the least price, not on the generic. So you don't want to do that because you could end up with a drug plan paying more unnecessarily because you just wrote down the wrong medication when you entered it into the portal or gave it to your agent. So when you make your list of medications, you need to pull out your pill bottles or packets and use exactly the name of the medication that appears there. There are also some people out there who can qualify for extra help with Part D. This is called the low income subsidy. And if your income is below 135% of the federal poverty level, you can apply for this and you may qualify. This program will not only potentially reduce what you pay for your Part D plan and premiums, but it eliminates the deductible, and it eliminates the coverage gap, and it reduces what you spend on the copays for the medication throughout the year. So people with really low incomes should always apply. It doesn't cost you anything to apply for this. You can go to ssa.gov there at that link that I've listed, and you can look up the parameters. So on that page, they will list that your income has to be below X dollars that year. And they're also going to have a list of resources or personal possessions that you have. So bank accounts and things like that would have to be under a certain limit for you to qualify for this program. You might think that very few people qualify for this, but there's a lot of people out there that would qualify who have never applied for it, and they just don't know about it. So I'm mentioning that here in case you or someone you know might be in that low income category so that you can apply for it to see if you can help reduce the cost of your medications. Okay. Reasons to enroll in Part D. Every year, we have people that either don't take any medications or they take a couple of generic medications. And they say, why should I enroll in this Part D plan and pay this premium when I'm only taking one medication and it's $1 at Walmart? Well, there's a couple of reasons why you would want to do that. The first one is if you don't enroll when you're first eligible and you do not have at least some other type of creditable coverage like employer coverage because you're still working or access to VA benefits, then they start accumulating a penalty. The penalty is equal to 1% per month of the national average premium for the months that you could have been enrolled in Part D, but you were not enrolled and you didn't have any creditable coverage. So what this means is if you wait 5 years and before you sign up for a Part D plan and you didn't have that any creditable coverage, now when you enroll, you're going to pay the plan premium plus 60% penalty added on every month for the rest of your life. So it's a substantial penalty. And considering that there are drug plans out there, like I said, in the $7 a month range, it's better for you to just grab one of those cheap plans, even if you're not taking meds, than to be accumulating this penalty out there. The other reason is that there are some drugs under Part D that are very, very expensive, and you can't just sign up for a Part D plan anytime you want to. You can sign up when you're first eligible during your 7-month initial enrollment period, or you can sign up in the annual election period. There might also be some special election periods that you would qualify for. So let's say you lose a drug plan because you move to a different state, you would have a special election period to grab a new drug plan in that state within a certain window of time. In my book, I have an example that I gave from my own agency about a client of mine who never wanted to buy a drug plan. She was perfectly healthy. And every year we would talk to her about it. And we could never convince her. And then she got diagnosed with cancer. This was in September. They prescribed her this drug called Gleevec, which was over $5,000 a month. So from September to December, she paid $5,000 a month before I could use the annual election period to get her into a drug plan that would begin January 1st. So she spent $20,000 because she didn't want to spend $7 a month for a drug plan. I will tell you that insurance agents get paid very little on a drug plan. The commission that they make is something like $3 a month. So if you run into an agent that you're working with and they're telling you the reasons why you need to enroll in Part D, it's never because they're going to be getting rich off this enrollment. This is because you may find yourself in a situation where a very expensive medication need comes your way and you can't get into a drug plan until that following annual election period, and then they don't start until January 1st. In my opinion, this is the bigger risk about not having the drug plan. Now, maybe you're someone that has no medications and you're in the highest income bracket. So you would have to pay the plan premium plus almost $80 a month in an IRMA. And you're looking at this and being like, whoa, I'm going to have to spend around $100 a month and I don't even take any medications. That might be something to look at where you're making a decision between, do I want to pay this now so that I don't risk that I may not have the coverage later when I need it? Or do I want to just go ahead and not enroll and incur the penalty that I know I'm going to have later because I'm trying to avoid the IRMA that I'm going to have to pay now? So you can see it gets a little tricky here where you're really having to dig into the numbers, and it's your personal choice that you will make, but just being aware of these two reasons why it really is a good idea to enroll. Okay, so now I'd like to finish up with why Medicare Part D will just drive you nuts. And it does drive people nuts because when you have drug insurance under age 65, probably through the employer that you've had, or maybe through the healthcare exchange, none of these things are in there, right? It's rare that you would run into a deductible, and there's no such thing as a coverage gap. And so it can be really frustrating, but I want you to remember Part D is not perfect, but it sure is better than what we had back in 2005, which was nothing. So we're lucky today that we have something to help with the cost of the medications, but Part D is not perfect because it has pharmacy networks and drug formularies and restrictions on drugs. There's the deductible, there's a coverage gap. There's expensive medications that can fall into a tier 5 where you might pay a pretty hefty coinsurance when you fill that medication. And even when you reach catastrophic coverage, you still pay that 5% trailing on with you until then. So that's one reason why Medicare Part D drives people a little crazy. The other one that happens is people forget the deductible. So a lot of times what we will see happen when an agent enrolls you in a drug plan, we have to go over every single page of the summary of benefits with you, and we have to read all of that. And you have to do the same thing. If you call an insurance company or Medicare and they're enrolling you over the phone, they have to read you all these disclaimers, and they will tell you this plan you're enrolling in has a deductible. Well, let's say you're not taking any medications and you had this conversation and you're enrolling in this drug plan in October. And then the following June, your doctor prescribes a medication that's $200. Well, you go to fill it and you're using your insurance card and the pharmacy is saying it's going to be $200. Well, you have forgotten all about that deductible conversation that your agent had with you 9 months ago. And you think this plan that I bought isn't worth anything because I'm having to pay this big price. Well, it's not that. It's just that you have to come out of pocket the first $480 on most plans. But this drives people nuts because they will forget about it. And then they always want to try to blame the carrier or blame the agent. And that's why when we enroll people, we're required to cover all those things. And when you sign your drug plan application paperwork, you're in writing attesting that you understand these things. So if it surprises you later on, it can surprise you, but there's no way around it. So just be aware that deductible is out there, especially if you're someone that doesn't take a lot of medications, and then all of a sudden have one that you need to fill. People also forget about the donut hole. So you've been paying $40 a month and then all of a sudden you pick up a drug and it's $100. What happened? Oh, the donut hole. And people want to say, well, nobody told me about this, except for everywhere in the world that you ever see anything about Part D, it all talks about the donut hole. And on the disclaimer that you sign with your application, or on the phone recording that you make with Medicare or with a carrier, they make you attest that you have been informed about the donut hole. But it's easy to forget that, right? We get complacent, we're paying what we're paying, and we just forget. And then this is really upsetting to people, of course, when that happens. And then some drugs cost a percentage. So a lot of times the lower tiers, like a preferred generic or non-preferred generic, you're just paying a copay. It's maybe a flat $1, $5, $10. But once you get up into tier 3, 4, and 5 drugs, these are drugs that have more expensive ticket prices. And a lot of them will charge you a percentage. So if you have a drug that costs more than $600 retail price, they can put that drug into tier 5. And your co-insurance on that might be 25%, or I've seen it as high as 33%. Well, that's a hefty amount of money because it's a heftily priced medication. And a lot of times with drugs plans, when you're under 65, they have just a flat copay and there's not a lot of percentages. So just knowing that with Part D, when you get into these drugs that are non-preferred or specialty, they can be pretty pricey on Medicare Part D. Prior authorizations are just a pain. You may need a drug tomorrow, but the insurance company says, well, we need this paperwork from your doctor. And it could take a couple of days for that all to get resolved and sent through. And people find that frustrating. You don't know where to call. So a hiccup happens and maybe you attended this webinar, but by middle of next year, who remembers all this crazy Medicare stuff anyway? You may feel like you don't know where to call to even get the answers to your questions. And then the annual election period, Uncle Sam in all of his infinite wisdom is making 60+ million people all review their drug plans during the same 7-week period each fall. So you will call your agent or you will call the insurance company and you are for sure going to be on hold waiting to get in touch with someone because there are 60 million other people all trying to make this decision at the same time. I think they should have people do it each year on their birthday so that we could spread that out, but that's not how it works. Everyone is squished into this 7 window. So if you plan to make a change to your drug plan, do not wait until December 7th. You want to be on that October 15th because every year at my agency, we turn away hundreds of people after December 1st because our backlog of people who have reached out to us earlier is so deep that we need that last week just to get through all the people that called us before. So be Johnny on the spot. When you receive your annual notice of change and that annual election period is coming up, you want to, if you know you're going to be shopping it, you want to do that early in the election period. So how would you review that Part D plan? The first thing you're going to do is look at your annual notice of change. The reason that your drug plan changes is Medicare adjusts the limits. So next year that deductible will be something else. It won't be $480. It might be $490. It might be $500. It might be more than that. We don't know. So when Medicare changes all of those things every year, the plans have to change alongside them to adjust to the new deductibles and limits that are on the different stages of the drug plan. And sometimes they may look at that and change, they may triple your drug plan premium, or they may drop some expensive medications from your formulary. And if you don't review your annual notice of change document that they send you in September, then you don't have the opportunity to make the change during the annual election period. So that annual election period exists because the plan that you're on is changing from this year to next year. And they want to give you the opportunity to change the plan if you don't like the changes that are coming with the plan that you have now. Now, that annual election period in the fall only affects drug plans and Medicare Advantage plans. It does not affect Medigap plans. So if you have a Medigap plan like a Plan F or a Plan G or a Plan N, that doesn't change from year to year. And the annual election period in the fall is not a period when you can change your Medigap plan and think that you don't get to answer health questions. The annual election period in the fall has nothing to do with your Medigap plan. You only have to worry about your drug plan, whether that drug plan is standalone or through your Medicare Advantage plan. So that annual notice of change that they send to you will come out to you in September. Most people get it by mail, but when you sign up for your drug plan, they will have a little box on there that says, would you like to get this electronically? Well, if you get it sent to you electronically, That's less paper, but you need to know to be on the lookout for it in your email box in September and not accidentally delete it because it's just one more Medicare email that you get. In there, it'll have the summary of benefits for the plan. It will have the drug formulary, and it will list each of the things that are changing. So a lot of times what they do is they'll list them side by side. So it'll look something like this. Here's what was covered this year, and this is what you paid. Here's what's covered next year, and that's what you paid. So you want to look through that carefully and make sure that there isn't anything changing on your drug plan or your Advantage plan that would be a problem for you. Some of the common reasons that people will change is that their monthly premium is going up significantly. It might be that on the formulary, one of the important medications they take is being dropped and it's not going to be covered anymore next year. Or if you have a Medicare Advantage plan, maybe your doctor is leaving the network and you want to change your Advantage plan in the annual election period. Those are the most common reasons people change, but some people just shop it every year because they want to make sure they're getting the best deal for what they spend. And so just knowing that everyone is doing this at the same time, you want to be early, review your annual notice changes in September, begin looking at changes that you can make on October 15th, and then you'll know that the changes will go into effect on January 1st. So your steps every year are to review that annual notice of change letter, make a list of your current medications, run an analysis to compare and make sure the plan that you're still on is still the right one for you for next year. And if you're deciding to join an Advantage plan during an annual election period, always check with your doctors to make sure that they are in the network. All right, and with that, what brings us to our Q&A period. And so we can look to see if you have a question that we didn't cover in today's webinar, you're welcome to pop that into the chat and we'll be happy to answer that for you. Any questions?
All right, we do have some coming in.
Okay.
So I'll just start from the top. Is
Okay.
there a plan that you can purchase to cover the donut hole?
There is not. And the reason is the reason the donut hole exists is they want everybody out there to always be thinking about if there's a generic drug that they could take. And if everybody filled the brand name drugs, they would hit the donut hole faster and Medicare as a whole would spend more money. So they don't allow any type of plan to cover the donut hole because they want people to feel that spending in the donut hole and think carefully about the medications that they're filling earlier in the year.
Okay. When is it likely that you'll need a prior authorization?
It could depend. So there are lots of different reasons out there that something could be taken. A lot of times they're looking to see, is there any other type of treatment that could be given that could be cheaper? Is there another drug that might be on there? So we see them for lots of different reasons, but your doctor will know how to handle these. So when a prior authorization limit is on there, you can talk to your doctor about it. He can file that exception form and then hopefully get it pushed through for you.
Okay. In terms of diabetes, does Medicare Part B cover the costs for some of the materials like lancets and test strips?
Yes. So if you have a Medigap plan, original Medicare and a Medigap plan, typically you won't pay anything for those lancets or test strips on a plan like a Plan G or a Plan N. Medicare pays 80%, your supplement pays the other 20%. And the other thing is if you are ordering other types of supplies, there is a tool that Medicare has on its website where you can even have those supplies shipped out to you. So there are lots of good things in place there for people with diabetes. One last thing to mention is that if you have an insulin pump, then the pump, the pieces of the equipment that make up the pump and the insulin all fall under Medicare Part B. So again, if you have original Medicare and a Medigap plan, you're going to have really good coverage there. If you have a Medicare Advantage plan, you want to look on the plan summary benefits to see what am I going to pay for lancets, test strips, and other pieces of diabetes equipment, such as insulin that would go with a pump. A lot of Advantage plans might say you pay 10%, you pay 20%. And that's something to consider what your expense might be for that if you're thinking about whether or not to join a plan.
Okay. How is durable medical equipment covered? Is that in Part D or other parts?
It's under Medicare Part B. So after your Part B deductible, which in 2022 is $233, then Medicare covers 80%. You would pay the other 20% out of pocket unless you had a Medigap plan to pick that up for you. Again, if you're on an Advantage plan, you would want to look on the plan summary of benefits to see what percentage they would charge you.
Okay. And how soon after you enroll in Part D does it come into effect?
It's usually the first of the month after you enroll, unless you're enrolling during that initial 7-month window or the annual election period. So if you enroll in the 3 months before your 65th birthday, your plan is going to start on the first of the month in which you turn 65. If you're somebody that's born on the first of the month, yours actually starts 1 month earlier. So if let's say you were a June 1st baby, you could get your Medicare and your Part D in place as early as May 1st. If you enroll in the 3 months after, you're still in your 7-month window, but it's the 3 months after you turn 65, there is a delay. And so when you're filling that application out, you need to know that, because sometimes people are not aware of that. They think the drug plan will start right away. But if you enroll in that very last month of the 7-month window, there's actually a 3-month delay before your benefits will start. So when you're applying for the drug plan, it's really important to ask your agent or the carrier, when is this drug plan going to go in effect? Make sure it matches what you are. If you're coming off of a group plan, like you worked past age 65, you're going to use a special election period to join a drug plan mid-year. Typically, it would be you would enroll in the drug plan. It will start for the first of the month after. And if you're changing or enrolling in a drug plan during the annual election period in the fall, the new plan always replaces the old plan as of January 1st.
Okay. All right, Sam, I see your question. I'm just going to reword it a little bit. Are discount Medicare Part D plans cheaper in the long run?
No, because so when you refer to discount plans like GoodRx or CleverRx, that is not insurance. So the little discount carriers, that might help you with some of the generic drugs. Sometimes you can find a drug price on one of those discount carriers on generic drugs that is less than what you would pay through your Part D plan. And then it's great. You just pay the cheaper amount, and it doesn't count toward Part D at all. But those little plans don't help nearly as much when it comes to brand name medications, because it's not insurance. So with filling those brand name medications, almost always you will find a better price through your Medicare Part D drug plan. And then that is counting toward getting you toward catastrophic coverage, so that everything that you are paying is being tallied. And then at some point you might hit that catastrophic coverage and be able to pay just 5% for your medications. So for the inexpensive medications, you could check those carriers, $1 here, $1 there. If it saves you, it's great, but it would never be a reason not to enroll in Part D.
All right. Well, that's all about the time that we have for questions here. I do want to thank Danielle and Dave for being here. What an interesting, informative webinar. And folks, I'm sure that Danielle and Dave could be here and we could talk for longer. This is a big topic. I do want to let you know that we will be sending out a replay of this event. So look to your email for a replay link of that event. And we will be also posting it on our website as well. On behalf of Advice Chaser, I want to thank you for being here, and I want to thank the organizations that have made this webinar possible today. Here at Advice Chaser, we're all about helping you find a financial advisor who's a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming, and we'll see you at another webinar soon. And we're getting some thank yous, by the way, Danielle and Dave, thank you so much. Bye, everyone.
Bye-bye.